2020 is the strangest of years. COVID, hurricanes, wildfires, an election. With all that going on, it'll be easy to miss one other joker in the deck. It's the start of flu season, and that affects seniors, people with disabilities, and their loved ones the most. Except this year, nobody knows what'll happen when the flu, which kills 10,000 to 60,000 every year, combines with COVID, which has killed at least 210,000 Americans. Dr. Michael Chang, an infectious disease specialist at UTHealth, said getting the flu shot this year is more important than ever. The news is not all bad, though. The steps we're taking against COVID could help tame the flu. But since the coronavirus is new, disease experts are unsure what might happen.
The honest answer is we're not sure yet. So there's not a ton of outcome information available for patients who were co-infected with flu and coronavirus. So as far as what would happen if you had both infections, we're not entirely sure. I think it's plausible that you could be pretty ill. Both flu and coronavirus do infect the lungs, the lower respiratory tract, and both of them can cause a significant amount of damage. And we see deaths from flu alone, and obviously we've seen deaths from coronavirus alone. So, it is definitely possible that having both at the same time could make you really ill. But like I said, we honestly don't have a ton of data yet. And then the other piece that we're not sure is if you've had coronavirus, does it make it easier for you to get the flu? Or if you have the flu, does it make it easier for you to get the coronavirus? And again, fortunately and unfortunately, I guess we don't have a ton of information about that available yet. And so, in other cases, there is some evidence that when you have one virus, like the flu, or other viruses that circulate in the winter, because they all tend to infect from the same routes. They all tend to infect in your nose and eyes and mouth and throat, and then go into the lungs, a lot of these respiratory viruses, that the damage that they do can make you more susceptible to other infections. Another one. But generally speaking, we feel like, having a virus, probably makes it a little bit easier to get another one. So again, not a lot of data available, but there's definitely some concern that having coronavirus will make it easier to get the flu later, or having the flu will make it easier to get the coronavirus later. Not even necessarily at the same time, but kind of in a back-to-back fashion. Okay. Now the reason and I was going to say the really interesting reason though why we don't have a lot of information about this is that that the interventions and the measures that we take to prevent coronavirus from spreading also help flu from spreading. They keep flu from spreading too, right? So they're both respiratory viruses. And so, the hand hygiene and the masks and the physical distancing, not gathering in large groups, staying home if you're sick, all those techniques also work for the flu. So when you look at countries that are coming out of winter in the southern hemisphere, like Australia, New Zealand, large, South America, et cetera, they actually had very, very few flu cases. And in Australia's flu season this year was extremely mild. And that's because Australia has been pretty strict, and New Zealand as well, about, restricting activities and gatherings. They've kind of both started and stopped, restrictions on, businesses kind of throughout the winter in order to limit COVID-19. And as a secondary effect of that, they've also limited flu spread. And so Australia has reported the most, historically low, number of flu cases in years, during this COVID-19 pandemic. And so the reason we don't have a lot of information is that, there just hasn't been a lot of cases of both. The United States is going to be potentially, and parts of Europe are potentially going to be the first time that we find out what happens.
Chang said treatment protocols for COVID are improving, but during winter, intensive care units in hospitals everywhere are already busy, treating flu, pneumonias, and other flu-related illnesses. These patients usually stay in the hospital a short time, but treatment for COVID patients takes unknown lengths of time, often for weeks on end. In the areas where coronavirus is still spreading, it could overwhelm the hospitals.
Even if you have the possibility of having a mild flu season, because there's so many unknowns with respect to the interaction between flu and COVID-19, I think it's really important to still get a flu vaccination this year. And the reason I say that is just because we do know that flu vaccine is effective at preventing serious flu illness, right? So it's never as effective as we would like, but it is still kind of the best option we have to prevent flu illness, severe flu illness, I should say, and flu infection. And so, again, with all the unknowns about it, if we know that this intervention can be effective, and there's all these unknowns that are coming up, then in my mind, I think it makes even more sense this year to get a flu vaccine than in other years where you aren't dealing with a new unknown factor. We'll see what happens. I'm praying that we have a mild flu season as well. I hope that, people across the country continue to physical distance, wear their masks, do hand hygiene, to control COVID, which will also help with the flu. I hope people get their flu vaccine. And I hope that, instead of having a worst case scenario, we can actually have a good, winter.
For the People's News, this is John Moeller reporting.